The first nuance about patient experience and why it's important is to first change our language a little bit around patient versus person-centeredness and understand that the person is the most important part in the center of all our care.
Patient experience is important in today's healthcare environment because it is about the way we deliver care. I think there's this misnomer or disbelief or incorrect branding in the United States and across the world today that somehow patient experience is about making patients happy. It is not. It is about how we deliver what we do. Safety, quality, satisfaction, culture, how we deliver value, they are all linked. That is the patient experience. Patients don't distinguish between whether there's a difference in safety or quality or how they're being treated. To them it is one, and to us it needs to be one.
Where I've spent most of my career is in marketing, and what I tell people is the patient experience is actually the marketing of the organization, because how the experience is delivered and how people then go out and talk about it is basically your marketing, and that's going to impact, obviously, your future viability.
It doesn't matter what you do in the organization, whether you're in the basement turning on the lights or whether you're transporting people around or you're performing surgery. All of us need to support the mission of the organization.
You have to understand it's the whole experience. When you're in telemedicine and expanding your home health, I think you have to understand that patient experience is kind of an all-encompassing thing that's now expanding into many different settings of care, and we have to understand that the experience has to be consistent within all those settings. It can't be good in one place and bad in the other. It's still then going to reflect badly on the organization. You want somebody to actually listen to you and understand what you're saying. I know there's a lot of emphasis put on patient empowerment and patients going out and searching, but I think at the end of the day they still don't know, and they're depending on the clinician and their staff to help you. And I think the first most important thing is they want you to listen and actually feel that you're listening.
Patients expect us to be empathetic. I think they expect us to be humanistic, compassionate, and I think they expect us to deliver high-quality care. And I don't think that patients are generally sophisticated in understanding what they're getting. So they view their success with us based on things that they do understand. And the things that they do understand is if we are communicating. The things that they understand are whether or not we're connecting with them on an emotional level. Empathy, simply put, is our ability to understand what it means to be on the other side of a relationship.
You really need to put yourself in the other person's shoes to understand what they're going through. And again, I think you can't get there unless you're asking the right questions of somebody. And I think when you do that, it becomes much more sincere and appreciated by the patient.
The role that empathetic listening plays in healthcare is that I simply don't think you can deliver effective care unless you are able to listen empathetically. You know, our ability to successfully deliver care for patients requires that we're able to understand the perspective that the patients are coming from, our ability to put ourselves in their shoes. It will make us more compassionate. It will make what we do more humanistic. We have lost that in healthcare, and we need to bring that back.
I've been through a lot in the last, I call it last 71 days, with 2 deaths in the family, 2 births in the family, just emotional swings, highs and lows, and then becoming a caregiver for my mom, who's 92, and having to move her from Florida to North Carolina. And I'll just briefly tell you her first physician appointment. We went to the physician, and he had reviewed her records beforehand, and clinically he kind of knew what was going on with her. So he came in and kind of dispensed with a lot of that, because at 92, quite frankly, she does pretty good. After he did all that, he knelt down. He literally knelt down on the floor, and he said, "Tell me what's going on. Tell me what's going on." And it was when my mother first opened up, since my sister's passing, about grieving her daughter. And he kept listening, and the more he listened, the more she felt comfortable in sharing. And he did something remarkable in that, I say it in a good way, he did nothing. What I mean by nothing is he told her, and she happens to live in an apartment complex across the street from the practice, he said, "I don't want to see you for 3 months. I want you to go back. I want you to heal and grieve and make new friends and have new rituals, and I want you to then come back and we'll talk about your health care." Well, to me, that was remarkable. And in fact, to the point, so remarkable of how he really listened and did the right thing, and that I'm switching my physician to now go to him for my health care. And I think that probably says all you need about empathy and listening.
Throughout the healthcare encounter, I always try and put myself into their situation to understand what they're going through. I don't think that it's one particular tactic that you use at any particular time in an encounter with a patient or the family. I think it's something that you always have to have. If we lose touch of the human side of what we do, just delivering whatever the technical side will never be good enough for treating the emotional side of the patient or the spiritual side of the patient. So I think that one of the things that I try and do all the time is really to constantly remember that the person sitting across from me or the person sitting in that bed across from me could be me. What it really comes down to in layman's terms is understanding emotions, understanding how your emotions impact a particular situation, and giving someone like myself, a leader or a manager, the ability to understand how someone else's emotions may come into a conversation or a work-related environment. The important thing about emotional intelligence, I think, in healthcare is that it's critical for what we do every day. Number one, we are charged with a very difficult task, which is to take care of patients, or really taking care of people. And our ability to have empathy really rests with our ability to understand how our emotions interface with that interaction. So it's very important just from the care delivery standpoint. But if you move up towards a leadership position and think about what we're doing in healthcare and the responsibilities that we have as managers and leaders, we need every one of our leaders to understand what they bring to their job every day in terms of how their emotions impact what they do, and also to have an understanding how the people who work for their leaders, how their emotions come to the environment so that we can better manage our situations. Until you take the time to really understand not only what I bring to the table in terms of what I'm doing every day, but take the time to understand what your people bring to the table with their emotions, you don't really have the ability to successfully manage a team to high performance. Daniel Goleman actually describes 6 different leadership styles, and each style is based on emotional intelligence. It's important for leaders to understand the 6 different leadership styles because each one of them brings something that's successful to a particular situation. There may be a time when you need to be an authoritarian leader and you need command and control to make a decision, and there's no debate about what you're going to do, especially in healthcare. When there's a crisis moment, when you're taking care of a patient emergency, it's not a time for democracy. However, when you're dealing with change management in a situation, especially in healthcare, when you look at what we're facing in the external world today, it may be better to be an affiliative leader where you can draw people together, find common strengths, and come to a consensus to what you're going to do for the organization.
People have to know that what they do in that particular place in the organization, whether they never see a patient personally, is important and it impacts them. If people are, leave a hospital and they're concerned with all the follow-up care and just getting better, to have something go wrong in other areas that were part of the care, in this case billing, it impacts their healing, and it also impacts their perception of the overall experience. The idea of a chief experience officer, it was something I wrote about 7 or 8 years ago, but it was simply nothing more than a marketing person saying that at the end of the day, word-of-mouth marketing is your most important marketing tool. And really, doesn't it come down to the experience of care? And if the experience of care is that important, shouldn't we have somebody overseeing it on a consistent basis, on a holistic basis? And I think that has proven to be something that is really needed in healthcare more now than ever because of the way healthcare is expanding and because of the fact that it's moving out of the organization. There are new competitors emerging in the healthcare space that never existed before. And so, Walmart's getting into, rural healthcare. Walmart's also contracting with large health systems to seek their health care. And so I think that when you look at these non-conventional players moving in, you really have to start paying attention to how efficiently they can move, how fast they can move, how they can set up, and before you know it, you have competitors that you didn't know you had.
We're moving rapidly to an environment where we will be paid based on quality. So as physicians, as other caregivers, as leaders in healthcare, we need to understand how we deliver more effective care, more efficient care, healthcare that's higher quality, that's safe, to accommodate this idea that it's about value and high quality.